Hello, this is Kim Jong-il. Today is the second lecture on the twin block appliance. Let's take a look at attaching a bracket using a twin block appliance. There are several advantages of using twin block appliances. Firstly, the vertical dimension increases. The overjet is reduced, proper arch form can be made, and if the maxilla is slightly narrow, it can solve anteroposterior's problem by treating posterior crossbite. But there is a problem. It is only effective when the patient wears the appliance properly. For adults, there is a limit to proper application. We use functional appliances when treating Class II malocclusion. In the case of excessive overjet, if we move the mandible forward, the vertical dimension will increase. In conventional orthodontics, resin base is grinded for the extrusion of mandibular molars after the VD is increased. In this case, the mandibular molar is extruded further, resulting in steeper POP. Twin block appliances are effective, but extremely inconvenient for patients who have to wear them for 24 hours a day. Dr. Clark even suggests patients to wear their twin block appliances even while eating. However, in MIABU treatment, the occlusal plane is more emphasized than the functional appliance itself. After using the functional appliance, it would be important to make the steep POP flat. Therefore, we need strategic leveling and alignment SLA to perform strategic leveling using a twin appliance. The treatment process with fixed appliances consists of strategic leveling and finishing with MIO. In the strategic leveling and alignment section, we first align the anterior teeth. Then we use an open coil spring around tooth number 6 to upright and derotate the mesially inclined molar. At this time, if we use twin blocks aligning the anterior teeth, the effects are maximized. By the end of this lecture, we will learn how to attach fixed appliances brackets by using twin blocks. Let's summarize the steps of clinical control when using twin block appliances. First, the patient puts on the twin block appliance. The patient should wear it all day except when eating and brushing teeth. The screw should be turned twice a week. At the time of visit after 1 month, we must evaluate whether space has been created in the maxillary anterior region. If there is space in the maxillary anterior region, we can perform strategic leveling from the maxillary left and right tooth number 4 or number 5. Or for cases of full Class II canine key, we can do so by bonding brackets to the maxillary tooth number 1, or 2, number 4, and number 6. We must remove the Adams clasp on tooth number 4 on the maxillary appliance. Even if we remove the Adams clasp at tooth number 4, we can achieve maintenance from the Adams clasp at tooth number 6. After the second visit, the patient needs to wear an appliance only at night. Unlike Dr. Clark, who suggests full-time wearing for 6 months, I personally prefer nighttime wearing because I prioritize strategic leveling over the twin block appliance. Depending on the level of crowding in the anterior teeth, the screw may be rotated an extra 2 times per week. From the third visit, there may be some space in the mandibular anterior region as well. Attach brackets to the mandibular anterior teeth and adjust the mandibular twin block. Depending on the level of crowding and the transverse relationship, you can turn the screw or stop turning. Twin block appliances are usually worn for 3 to 4 months. It is necessary to wear full-time for the first month, but from the second month, it is required to wear at nighttime. Our goal is to align the anterior teeth first by using the appliance. There is crowding in the maxillary and mandibular anterior region. This is a Class 2 malocclusion patient with excessive overjet. First, we let the patient put on the twin block appliance. Adams clasps is usually placed on tooth number 4 and number 6 for twin block appliances. I notify the patient that they must wear it at all times except when eating and brushing their teeth. The screw is turned twice a week. If space is created in the maxillary anterior region in the second month, attach brackets to the maxillary anterior teeth first. Brackets can be attached to the left and right maxillary tooth number 5, or number 1, number 2, and number 4. Initial bracketing is applied depending on the pattern of malocclusion. The Adams clasp should be removed from the maxillary tooth number 4 region, and the resin on the palatal surface of the maxillary anterior region should be trimmed to allow the teeth to move. Since then, wear the appliance at night. Tell patients to turn the screw twice a week. In the third month, attach a bracket to the mandibular anterior region. Engage 0.06 niti wire on the maxilla and 0.04 niti on the mandible. Wear at nighttime and, if necessary, rotate the screw twice a week. In the fourth month, attach a bracket to the maxilla tooth number 7. At this point, the anterior maxilla have already been leveled. Use an open coil spring on the 0.06 niti and tooth number 6. Stop wearing the maxillary appliance. Also remove the mandibular appliance when anterior leveling is complete. But if there is still crowding, wear only during nighttime. What would happen in the next month? The maxillary second molar has been derotated. Attaching a bracket to the maxillary first molar at this stage makes it easier to widen the arch. Since the anterior region is already leveled with R06, niti 016, niti is easily engaged in the maxilla. In the mandible, attach a bracket to the second molar and use an open coil spring on tooth number 6, or number 5 and number 6. As such, we can derotate and upright the mesial in-rotated and mesially angulated mandibular second molar. What about the month after? We attach a bracket on the mandibular number 6, and if there's crowding around number 5, use an open coil spring on number 5. Attaching the bracket to tooth number 5 afterwards makes leveling more convenient. At this time, the .016 niti is left untouched and maintained in the maxilla. Afterwards, engage the mio at 0.06 x 0.022 ss on both the mandible and maxilla, and use various elastics such as short class 2 to adjust occlusion. Please remember the processes of performing strategic leveling using twin block appliances. For cases of excessive overjet like this, use a twin block appliance to pull the mandible forward and attach a bracket to the maxilla first and to the mandible a month after. The twin block appliance is worn in the first month. The screw is turned twice a week. Tell the patient to keep the appliance on at all times except when eating and brushing teeth. In the second month, attach brackets from maxillary tooth number 5 to tooth number 5. The screw is still turned twice a week. In the third month, attach brackets to the mandibular anterior teeth. As such, twin block appliances are usually used for 3 months or 2 months if necessary. Let's take a look at this patient. There is excessive overjet. It is a half class 2 canine key. There is slight crowding in the anterior region. The maxilla has a narrow dental arch. The maxillary lateral incisors of the maxilla are small. First, to resolve the overjet and expand the maxillary dental arch, a twin block appliance with screws was used on the maxilla. The screw was turned twice a week. From the second month, some space is created in the maxillary anterior region. We can attach brackets from maxillary tooth number 5 to number 5. The twin block appliance is worn only at night, and the screw is turned twice a week. The maxillary dental arch is widening, but the mandibular dental arch is narrowed lingually. We engage 0.014 Ni and perform leveling on the maxilla. We can attach a bracket to tooth number 7 and use an open coil spring around tooth number 6 and 16690. We also attach brackets to the mandibular anterior region. The mandibular first molar is still lingually narrow. I consider one of the following 3 methods when the mandible is lingually narrow. 1. Schwartz appliance. An expansion screw was already included in the twin block appliance to widen the mandible, but the mandibular molar was still not buccally uprighted. 2. Lingual arch. Overlay arch wire as expansion arch wire. The important factor is leveling the anterior teeth quickly. The maxillary dentition would already be leveled at this time. A bracket is attached to mandibular tooth number 7, and an open coil spring is used around tooth number 6. Then, a bracket is attached to number 6 to level it again. For cases of Class 2 malocclusion, it may be difficult to properly attach the bracket to mandibular tooth number 7 in its place. In this case, blue resin can be used for bite raising. For details on this procedure, please refer to the lecture on eliminating the occlusal force. The maxillary and mandibular dentition have easily been leveled. Mews are engaged in the maxilla and mandible, and short Class 2 elastics are used to adjust occlusion. Elastics are used to align and center the midline and Class 1 canine relationships. With this, the treatment is completed. Compared to pre-treatment, the narrow shape of the dental arch has been corrected, and it has become a Class 1 canine key. The small maxillary lateral incisor needs to be sized up. The mandible normally protrudes when using twin block appliances. There are 2 cases when the patient stops wearing twin block appliances. Either the mandible returns to its original position, or it remains protruded. If the mandible remains protruded, it means that a tooth somewhere is touching and preventing the mandible from moving backward. In this case, the twin block appliance is no longer needed. It is also possible for the protruded mandible to move backwards again. To prevent the posterior movement of the mandible after patients stop using twin block appliances, Dr. Clark suggested using anterior bite plates on the maxilla. This is very inconvenient to use anterior bite plate, as we would need new impressions and new appliances. Instead, if we make the bite block of the mandibular twin block appliance thinner by half, the mandible will not move backward as the mandible contacts the maxillary premolar region. This makes it significantly easier to attach the appliance to the mandible. This contact of the mandibular teeth or appliance on the palatal cusp of the maxillary premolars is called retrusive control. Functional appliance is a great appliance for increasing vertical dimension. However, controlling the occlusal plane is more important than increasing the vertical dimension. Many use functional appliances and then grind the resin base for extrusion of the mandibular molars. However, I don't grind the resin base. If we keep it and pull the mandible forward and perform strategic leveling, the mesially angulated mandibular molar is uprighted. This indicates the flattening of POP. To treat Class 2 malocclusion, we must flatten steep POP. Therefore, I recommend strategic leveling using twin block appliances. Let's review. The treatment procedures in MIO are simple. Perform strategic leveling first and finish with MIO. Strategic leveling here is first aligning the anterior teeth and using an open coil spring around the first molar to upright and derotate the second molar. If we attempt to align the anterior teeth after using twin block appliances, the mandible will most likely move back. Therefore, it is important to arrange the anterior teeth using the twin block appliance. In other words, attach brackets using the twin block appliance. As a result, the effect of the appliance is maximized, while treatment duration is significantly reduced. Thank you for watching.